And away from security to health, a team of health professionals are calling on the federal government to make available special intervention funds to tackle the rising cases of hepatitis, diabetes, and other killer diseases in the country. They made the call at a one-day health awareness, sensitization, and free medical services to indigent citizens in Enugu. Bamidele Ajayi has more.
The growing number of people living with diabetes mellitus, hepatitis, and other killer diseases in Nigeria is becoming alarming. The explosion in the number of these patients may be imminent if urgent measures are not taken to address this trend. The World Health Organization estimate for Nigeria shows that 4 million Nigerians are diabetic, and nearly 4 out of 11% of the population lives with diabetics. Also, the International Diabetic Federation estimates that by 2040, the global prevalence of diabetics is likely to affect 10% of humanity. More than 1 in 3 people with diabetes will develop complications of eyes known as diabetic retinopathy. At this medical screening exercise put together by a team of medical experts and Toscana Sport Club, the need for government at all tiers to increase funding for health sector was the center of discourse.
To support the less privileged. So knowing that even if somebody is eating food and the person is sick, so you are not actually doing the best. So we have been doing this for a long time.
If you look at here, you can see there are eye doctors, there are general treatments. So we did this just to make Enugu states or Easterners to understand that health is wealth.
These people here are concerned over the functionality of the health insurance scheme, and according to them, if properly done, it will help to reduce out-of-pocket measures in assessing quality healthcare delivery.
Now they've signed it. Let them vote more money into the health sector, encourage more people to come. By that, they will reduce the amount of people who have medical issues without access.
This Nigerian musical icon speaks to the essence of ensuring that every citizen of the country is not denied access to quality health care. Report shows that patients with diabetics are 25 times more likely to suffer severe eye problem than people without diabetics. Already, the rate of eye disease among Nigerians living with diabetes is as high as 53.2% of the number of people with foot ulcers in some centers, making diabetes the most common cause of non-traumatic optometric challenge in the country. Bamidele Ajayi, TVC News, Enugu.